Which intervention is most likely to improve cardiac reserve in a patient with ischemic heart disease? A. Beta blocker therapy. B. Nitroglycerin administration. C. Coronary artery bypass grafting, CABG. D. Diuretic therapy. Answer: C. Coronary artery bypass grafting, CABG. How does a decrease in preload affect cardiac reserve? A. It increases cardiac reserve. B. It decreases cardiac reserve. C. It has no effect on cardiac reserve. D. It only affects cardiac reserve in conditions of hypovolemia. Answer: B. It decreases cardiac reserve. In a healthy individual, what is the typical range of cardiac reserve as a percentage of the resting cardiac output? A. 50 to 100%. B. 100 to 200%. C. 200 to 300%. D. 300 to 400%. Answer: C. 200 to 300%. Which diagnostic test is most commonly used to evaluate cardiac reserve in clinical practice? A. Electrocardiogram, ECG. B. Chest X-ray. C. Stress echocardiography. D. Holter monitoring. Answer: C. Stress echocardiography. Which of the following is a consequence of a significantly reduced cardiac reserve? A. Increased exercise tolerance. B. Decreased likelihood of arrhythmias. C. Enhanced cardiac remodeling. D. Increased susceptibility to heart failure symptoms during stress. Answer: D. Increased susceptibility to heart failure symptoms during stress. How does chronic hypertension affect cardiac reserve? A. It increases cardiac reserve. B. It has no effect on cardiac reserve. C. It decreases cardiac reserve over time. D. It improves cardiac efficiency. Answer: C. It decreases cardiac reserve over time. In patients with hypertrophic cardiomyopathy, what is the primary reason for decreased cardiac reserve? A. Reduced heart rate. B. Increased myocardial oxygen demand. C. Decreased stroke volume due to impaired ventricular filling. D. Increased blood volume. Answer: C. Decreased stroke volume due to impaired ventricular filling. Which of the following therapeutic interventions can directly enhance cardiac reserve in heart failure patients? A. ACE inhibitors. B. Anticoagulants. C. Calcium channel blockers. D. Statins. Answer: A. ACE inhibitors. What is the effect of aortic stenosis on cardiac reserve? A. It increases cardiac reserve by reducing afterload. B. It has no significant impact on cardiac reserve. C. It decreases cardiac reserve by increasing afterload. D. It decreases cardiac reserve by reducing preload. Answer: C. It decreases cardiac reserve by increasing afterload. Which of the following medications can improve cardiac reserve by increasing myocardial contractility? A. Beta blockers. B. Diuretics. C. Digoxin. D. Nitrates. Answer: C. Digoxin.